What is cholesterol? Think of your arteries like water pipes. Over time, a fatty substance called cholesterol can build up inside them like sludge, slowly narrowing the pipe. When LDL, bad cholesterol, builds up inside your arteries, it makes it harder for blood to move through them. If this plaque becomes unstable and breaks open, it can lead to a heart attack or stroke. Not all cholesterol is bad. There are two types: LDL, low-density lipoprotein, the bad cholesterol that builds up in artery walls; HDL, high-density lipoprotein, the good cholesterol that carries LDL to the liver to be removed from the body. What are statins? Statins are prescription medicines that doctors prescribe to lower LDL cholesterol and protect your heart. They work by blocking an enzyme called HMG-CoA reductase that the body needs to produce cholesterol in the liver, causing the liver to lower the amount of cholesterol it makes. They also reduce plaque and inflammation in the arteries. Some statins can decrease your LDL, bad cholesterol, by 50% or more. They also decrease triglycerides, blood fats, and may increase HDL, good cholesterol. Statins are usually taken once daily. They do not cure existing heart disease, but they significantly reduce the risk of future heart attacks and strokes. Being prescribed a statin means your doctor has identified a real benefit in managing your long-term cardiovascular health. Side effects of statins. While statins are effective and safe for most people, they are linked to certain side effects in some individuals. Here is a plain language breakdown. 1. Muscle pain and weakness. Most common. One of the most common complaints is muscle pain, felt as soreness, tiredness, or weakness in the muscles, especially in the arms, shoulders, thighs, and buttocks. The pain can be mild discomfort or serious enough to interfere with daily activities. The Mayo Clinic estimates that no more than 1 in 20 people, 5%, develop true muscle pain. In rare severe cases, statins can cause a life-threatening condition called rhabdomyolysis, where muscle cells break down and release a protein into the bloodstream, leading to extreme muscle pain, kidney failure, liver damage, and in very rare cases, death. Only a few cases occur per million people taking statins. 2. Liver enzyme elevation. Statin use can occasionally cause an increase in liver enzymes, signaling inflammation. If the increase is mild, you may continue the statin. If severe, your doctor may switch you to a different one. Warning signs to report immediately: unusual fatigue, loss of appetite, upper stomach pain, dark-colored urine, or yellowing of the skin or eyes. 3. Raised blood sugar. Blood sugar levels may increase when taking a statin, which can lead to type 2 diabetes. The risk is small, but real and important enough that the US FDA has issued an official warning on all statin labels about this. People with prediabetes should be especially monitored. 4. Memory and mental confusion. Some statin users have reported memory loss, brain fog, and confusion. The FDA has added this as a labeled warning. However, most major studies, including those from the Mayo Clinic, find limited evidence of a direct cause and effect link, and these symptoms are generally reversible when the medication is stopped. Some research even suggests statins may help protect against dementia. 5. Digestive problems. Some people experience nausea, stomach pain, or constipation. These are generally mild and often improve over time or with a dose adjustment. 6. Depletes CoQ10. Statins can lower the body's natural levels of coenzyme Q10, CoQ10, an enzyme important for muscle energy. This may contribute to muscle fatigue and weakness. Some doctors recommend CoQ10 supplements alongside statins, though research is still ongoing. Important. Never stop statins on your own due to side effects. Always speak to your doctor first. A simple dose change or switching to a different statin often resolves side effects while keeping you protected. Why some people look for natural alternatives. People explore natural alternatives to statins for several reasons: intolerance to muscle pain or fatigue, side effects, concern about long-term liver or blood sugar impact, preference for drug-free approaches for mildly elevated cholesterol use alongside statins to enhance results and potentially lower the required dose. Honest clarification: no fruit or food can replace a statin when your doctor has prescribed one, especially after a heart attack, stroke, or with very high cholesterol. However, for people with mildly elevated cholesterol, or as a powerful complement to treatment, the following fruits have solid clinical evidence behind them. Fruits that naturally lower cholesterol. Fruits work through three main mechanisms: soluble fiber, pectin, binds to cholesterol in the digestive system and removes it before it enters the bloodstream. Antioxidants, flavonoids, and polyphenols prevent LDL from oxidizing and forming artery-clogging plaque. Plant sterols and healthy fats directly block cholesterol absorption or improve the LDL-HDL ratio. 1. Citrus fruits: oranges, grapefruit, lemons, limes. Citrus fruits are rich in pectin, a soluble fiber, and vitamin C, which help reduce cholesterol absorption in the gut. Among citrus fruits, bergamot, an Italian citrus, has the strongest clinical evidence. Its flavonoids reduce cholesterol synthesis in the liver and prevent LDL oxidation. Studies in individuals with metabolic syndrome showed significant reductions in total cholesterol, LDL, and triglycerides. Note: grapefruit can interact with some statins, especially simvastatin. If you are on statins, ask your doctor before consuming grapefruit regularly. 2. Apples and pears. Both are high in pectin and soluble fiber that act like a sponge in the gut, binding to cholesterol and flushing it out of the body before it is absorbed. Eat them whole, with skin, for maximum fiber benefit. 3. Berries: blueberries, strawberries, raspberries. Among the most clinically studied fruits for cholesterol. A meta-analysis of 16 clinical studies involving over 1,100 participants found that vaccinium berries, blueberries, cranberries, produced significant lipid-lowering effects, lowering total and LDL cholesterol while raising HDL cholesterol. Berries as whole fruits, juices, and purified extracts have all shown benefit in people with elevated blood lipids, type 2 diabetes, and metabolic syndrome. 4. Avocado. Technically a fruit, and one of the most powerful for cholesterol. Avocados are high in monounsaturated fats, which raise HDL, good cholesterol, while lowering LDL. They also contain fiber and plant sterols that directly block cholesterol absorption. Brown University Health lists avocados as one of the top foods for cholesterol management. 5. Grapes and pomegranate grapes contain resveratrol, an antioxidant that improves heart health and lowers LDL. Pomegranate contains nearly 3 times more antioxidants than green tea or red wine. A senior clinical dietitian at Apollo Hospitals noted that pomegranate's polyphenols protect the heart by reducing LDL oxidation in the arteries. Research also shows pomegranate may help lower blood pressure. Note: if you have low blood pressure or take blood pressure medication, consult your doctor before taking pomegranate regularly. 6. Guava and kiwi. Both are high in soluble fiber and vitamin C. Kiwi in particular has emerging evidence for reducing triglycerides and platelet aggregation, reducing clot risk alongside cholesterol benefits. Final word: the smartest approach is not statins or fruits. It is both together, under medical guidance. A heart-healthy diet rich in the fruits above, combined with exercise and not smoking, can meaningfully reduce your cholesterol, and may allow your doctor to prescribe a lower dose of statins with fewer side effects. If you are on statins and experiencing side effects, do not stop on your own. Talk to your doctor. A simple adjustment often makes all the difference.